Hi, this is Dr. Christopher Phelps, founder of the Phelps Institute here in Charlotte, North Carolina. I wanted to give you a little bit of background information on a case we did for our C1 Do 1 ceramic implant training course here at the Phelps Institute. Now, this course was done in conjunction with my institute and the International Academy of Ceramic Implants and shows the surgical placement of the Xeramex XT implant system in the number 14 and 15 positions. Let's look at a few key points from this case. First and foremost, planning prior to the surgery is key. Before we began with this patient from a surgical aspect, we did a CBCT evaluation to measure the bone volume that was present and to make sure that the patient was a candidate for dental implants. Intraorally, we used the IIT system that you see in the photos to help guide us on proper implant positioning since this was a non-guided case. Using these tools, a full thickness flap was raised, surgical positions marked, and an osteotomy sites prepared down to the maxillary sinus floor. Using an internal sinus lift technique, the sinus was raised approximately 3 to 4 millimeters in both the number 14 and number 15 positions. A 4.2 by 10 millimeter and a 5.5 by 10 millimeter Xeramex XT implant was placed in the number 14 and 15 positions, respectively. The patient had excellent tissue response with minimal discomfort after healing. Closed tray impression copings were taken using Kettenbach's polyvinyl siloxane impression material after a 4-month integration time. Drake Dental Lab prepared the Xeramex prefabricated zirconia abutments for us and fabricated final porcelain-fused zirconia crowns. An abutment verification jig was utilized to seat the final abutments. And after X-ray verification and aesthetic approval by the patient, the final crowns were permanently cemented. To learn more about why you should be providing patients with a metal-free implant option and to get the surgical experience you need to confidently place these implants on your patients, join us at one of our next C1 Do 1 surgical courses. Each attendee will observe 2 to 3 surgeries and will be able to place 1 to 3 implants on a live patient that the Phelps Institute will provide you. You don't have to leave the country to get the surgical experience and confidence you need to offer ceramic implants in your practice. We look forward to seeing you at our next course.